All right, good afternoon, everybody. We're going to be presenting on postmodernism. My name is Daniel,
My
and
name is Andrea. Yeah.
I was waiting, Andrea, because I did not
Me
want to.
too. That's so
I said you're
funny because Amy always do it.
you guys
I
are
was like,
here.
I'm gonna let her go first.
gonna.
All right,
That's funny. I am Alicia.
great. And so, yeah, we're talking about postmodernism. So, yeah, does anybody want to start with their thoughts on postmodernism?
Yeah, I can go ahead and start. So I just before we started recording, we were kind of all talking about like our understandings of postmodernism and social constructivism, and I was just saying how for me, like my understanding of it was that it's kind of like this umbrella that a bunch of these different social constructivism is this umbrella that all of these postmodern theories fit under. So, and basically, like from what I understood of it, is that everybody's reality is subjective and it's informed and created and influenced by the relationships that you're in, and the language that you use. So that was my understanding of it.
Yeah, I agree. And when it comes to postmodernism as well, like I think that like the professor is saying that modernism is the way, while postmodernism is a way. And I think it's honestly, I think I agree with the postmodernism way a bit more because we kind of take into account like their realities and of course, like if we're speaking very vaguely, because I like to talk about like, okay, like let's realistically like we have the legalities and stuff like that, but you're always gonna get like differing views and things like that. And even when it comes to stuff that maybe I guess if we're gonna really like delve deep into it, like if we're go a postmodern way of thinking and someone wants to do something illegal, then it's like, okay, well, we can like still talk about what's free in there and like talk about that thought process and whatnot versus saying this is how you should live your life. But like being more, I feel like a postmodern way would be like, okay, yes, of course, not talking about anything crazy, but like, yes, that's how you could live your life, but there are these repercussions rather than saying like, this is how it's supposed to be. And if you don't follow that way, then it's not correct. Um, so yeah, then we have the social constructivism too, which is like how we understand and kind of what you were saying, Alicia.
Yeah, I actually think like that brings up kind of what you just said, Drea, of about like pathologizing. I feel that it's much easier to pathologize in modernism, like kind of saying like this is the one way to do this. And if you don't
Hmm.
fall within these kind of guidelines that we have, then there must be something wrong with you. Like you must have a mental disorder and you need to be institutionalized or hospitalized or go to I guess,
Yeah.
yeah, go to like a mental hospital, right? So like, whereas with postmodernism, I think there's like a lot more leniency and a lot more leeway to
Hmm.
understand people's different perspectives. And even like with culture, we talk about how there's different cultural understandings of even like voices, like how we were talking about in one of our classes the other week about schizophrenia, how in some cultures, that's a normal experience to hear voices, or that's a culturally accepted experience. So if we're going under a
Hmm.
modernism uh approach, we might diagnose somebody or misdiagnose somebody or just pathologize them. So I think that's really interesting that you brought that up, Drea.
Like, yeah, that's such a good point.
What do you think,
Okay.
Daniel?
I think that you guys are hitting it right on the head, and I don't have to say too much. But yeah, I agree though that the postmodern approach I think is it's a more modern approach. I'm not using modern and postmodern. I'm just saying like it's a current, like it fits the perspective of people today. There's an emphasis today on like people's experiences and how they perceive the world, and there's like a deconstruction of like pathologizing people to try and like say to diagnose them here or there. And I appreciate that, as someone who's had my own experiences in the mental health field, and then also my own experiences like as a recipient of therapy, and then also being in mental health, you know, I just did this training on like Medi-Cal, and like even the medical model of what it used to mean for people to get help, and what it is now with like Cal-AIM and like all these reforms that people are trying to, you know, I think that as a society we realize that there needs to be reform, and so this is kind of what we're seeing. This the postmodern approach, I think, was like the catalyst to these like more modern, uh, like more room for people to be themselves, and I think that's important. It's culturally
Yeah,
significant.
totally. Totally.
Yeah,
I,
and
I, I,
oh, go ahead.
I'm just curious. Oh, no, go
Go
ahead,
ahead. No, no,
Drea.
no, go ahead.
Okay.
Go ahead. I was going to say something else.
Okay. I was just curious. I had a question for you, Daniel, since you do work in this field. I mean, I wonder what you think about, the difference, because I know, especially using, the modernism, and especially we know, like in the past, at least in the United States, being involuntarily institutionalized was kind of common, and people had a lot of mistrust in
Hmm.
mental health care professionals, right? Because it's like, oh, if I say the wrong thing, then they're going to send me away. Or, if I'm even like for anxiety, like stuff like that, they could be sent away. So I wonder if there's a change along with, the change from modernism to postmodernism. And I wonder if you've like seen that at all. Like people are more comfortable to kind of disclose in the mental health field and seek that help with the shift to postmodernism.
Yeah, for sure. I mean, like like you said, there's kind of like a weapon, like doctors, psychologists, psychiatrists would all weaponize people's symptoms to try and like ultimately it didn't feel like the client was being helped. It kind of seemed like they were being put in like a worse position. Like you said, if you said that you're
Hmm.
hearing voices or maybe you're going through something and you want to take your own life, those are things that deserve to be taken very seriously. But today, though, I think that we're definitely like trying to help people who are in like incarceration, people who are incarcerated, people who are like seriously mentally ill, people who are homeless. I think that there's more of like a compassionate view towards these people to try and say, all right, well, this person has gone through all these things and this is how they got to this point that they're at now, and we should try to help them for what it is. Whereas before, I think um, it wasn't seen that way. It was kind of more like dismissive and like, well, we're gonna write these people off because they're just sick. And so so I do see it and I appreciate it. I think that there's still room to grow. I think that um, you know, just like other cultural things that are happening in America, like racism or systemic oppression, I think that there's still like flavors of that in what we're dealing with now, but we're also seeing some new flavor, and so that's how I
Yeah,
try that's how I try to approach it. Also, it's like um, I'm a new mental health provider coming in, and as someone like as a Mexican man, Latino, being young, I feel like I would probably easily be dismissed or put in a category of being a criminal, or because of my own experiences. And so that's how I try to practice it, is with this like postmodern approach. So, and I think I work with, and I love working with people who are also in that same vein. Like I work with a lot of like women coworkers who are like Asian and black and like from other countries. They all get it, the oppression, So there's like a real cultural understanding in the clinic that I work in, and that's why I love where I work. So
that's awesome. Yeah, I think that
Yeah.
you hit some really great points. I think that we also need to talk. We guess we kind of already did, but I'm gonna just kind of read off one of those slides and want to get your guys' opinion because we have a few more minutes here. But our professor was saying that social constructivism it has five main assumptions. The way that in which we understand the world is not required by what there is. The way in which we describe and explain the world are the outcomes of our relationships. Constructivism gains their significance through their social uh, events as we describe and explain. So do we fashion our future? Reflection on are taken for granted and the world is vital on our future well-being. So I guess I'm just like putting that up there because I think it really does like hit some really interesting points when we are practicing in therapy, like, right, like in the way that we understand the world is not required by what there is, right? So it's really kind of taking that perspective where we are shaping our reality and like this by the way that we use our language and like that's kind of what narrative therapy is about, like Lisa was saying before this session, that we really need to pay attention to the way that we construct a reality, then the way that we also use our language, because the language, in my opinion, is very important. And creating these, like, we kind of create these like limitations for ourselves in our language. And that's kind of what I think it hits on. I don't know if you guys would agree.
Yeah.
Yeah.
Yeah, I think so totally. And another thing that just like some of the readings talked about and also she talked about in the lecture was this idea that like reality can be looked at on different levels. And you know,
Mm-hmm.
we definitely covered the relationship level, kind of your personal experience level, all the things that happen, right? The linguistic level, but also the societal level, which I think Daniel, you were kind of touching on as well, like all these systemic forces that are coming to play that influence our reality, that influence our perception of reality. And so I think that's probably where like feminist theory and like critical theory come in, right? Like, to try to like social justice theory, right? Stuff like that to try to kind of like address that part of reality because everybody's is going to be different. Everybody's
Mm-hmm.
interactions with those systems are going to be different. Like Daniel, yours will be different just by nature of being a man from Dre and mine, but also like it'll be different because you are Latino and you know what I mean? So there's all these different factors that I think are also super important to take into context. And I think I'm not sure about this, but I think that's what they're talking about, like third wave, like third order change is really like taking that into perspective, which I am finding that it's very important to do because those things I think affect people's perceptions and people's realities just as much as language and relationships. What do you
Mm-hmm.
guys think about that?
I totally agree.
Yeah, I'm here with you. I totally agree. Yeah, and that, I think that postmodern appreciates the fact that like things are always changing, and that's life. Like, I remember reading in the bottom of like in the conclusion of one of the articles for this week, it just talked about how because I think like with evidence-based practice, you know, modernism fits really well, I think, with people who are really scientific because they just want to kind of like group a bunch of people together. And so the postmodern approach I think really talks about, really emphasizes that
Yeah.
nothing is the same.
Oh, yeah. I mean, I don't know if I would fully agree with the scientific part, but I think what you're saying, I think there's this misconception too, and maybe I'm biased because I don't know when you're considered a scientist or not. It's been exactly for fun for a long time. I think that people sometimes from an outside perspective, when you look at scientists, they're like, okay, they can be very rigid, and that could be very true. I will not disagree with that. But I think like a true scientist understands that science is always changing and that there's always new information, especially like not many things are laws and even those been challenged, right? So, and I think it's like taking in the data and also having a really good understanding that like I learned this in school and I understand that it's not always taught like in my undergrad. Like it was definitely taught that like, hey, like sometimes there's not funding for this stuff. Sometimes there's not, we don't have the room, we don't have the resources. Like right now, for example, I think they still are, like the NIH is on pause for funding. Like things like that, they don't have funding for it. People are not going to pay for it to happen. So understanding that we have to take those things with a grain of salt, and postmodernism really like gives us that perspective. Like, yeah, we have this data, but like that data isn't end all be all. And that's my perspective at least. Like, that's the way that I see science is that like it's always changing. Like, we found a new part of the brain, like in 2016, like 96 different parts. That was, it's just like, to me, it's like they like basically coupled them into different categories. But that's a whole other topic. Like, that's just an example, right? So, I see what you're saying, but I don't know if I would fully agree, but like I appreciate the take in that sense. Like it's just because it's some people can definitely be that way. I've definitely met those people. So I know what you're talking about.
Hmm.
No, I think you put it like very, very eloquently and but also concisely at the same time. Like I think you're spot on, right? And I think that's like another thing is like considering the factors that are influencing our research, right? And
Mhm.
influencing what we know. That's another part of postmodernism, right? Because
Yeah.
we're considering those things, whereas a modernist might not. Is
Yeah,
exactly what you
exactly.
said.
Like
Yeah.
we have to be very creative in our thinking, and I appreciate postmodernism for that way, for thinking like that way, like outside the box, that like this isn't law, and we should be able to at least take into account these perspectives because we don't know everything. We know very
Yeah.
little, actually, compared to what's out there. We don't know very much, but we're still learning, and it's probably we'll never end up learning it all.
Yeah.
But yeah. I think we're pretty out of time, but I don't know if anyone has anything else to say.
I'm
No,
good. I think we covered it. Yeah.
yeah,
All right.
cool. All right, I'm gonna go ahead and
Thank you.
stop the share. Thanks for listening. Thanks, guys.